Hi guys, how are you doing? It's Elaine, Bintz, certified health coach and personal trainer, and we're on day 17 of our 30-day health challenge in the year 2022. I hope everybody had a great weekend, and I hope you're having a great day today. So today's topic is a continuation of yesterday. So today's video is day 2 in a series of 6 videos about strength ratios. So if you haven't had a chance to check out yesterday's video, day 16, we discussed the shoulder joint. I went into a little more in depth about strength ratios, so go ahead and check out day 16's video. But just a brief recap, so strength ratio is the amount of strength you want to have at a joint. So today's topic is the elbow joint. So the muscles are going to be biceps and then triceps. So flexion and extension at the elbow joint. So the strength ratio that we're looking for is the amount of strength you should, or the appropriate amount of strength you want to have at that particular joint. So again, I'm a bachelor educated professional. I do not have a master's, nor do I have a doctorate. So if you are working with a physical therapist, chances are he or she is going to have more knowledge on this, and they have a more extensive tests than the basic assessments. So today's topic, elbow. The two muscles we're looking at today are biceps and triceps. So for this particular joint, I've often heard a lot of my clients, they play golf or tennis, and they'll have like medial epicondylitis or lateral epicondylitis. They'll have some sort of inflammation happening, and depending on if they're ambidextrous or if they're dominant on one side of the body, if they have a repetitive stress injury, an RSI, icing and therapy and the liniments, those like icy hot things you would put actually on the joints, and then your NSAIDs, your anti-inflammatories, things like that, they only do so much if you continually strengthen one side of the joint and not the other. So a very common thing I see, although this joint, you want to have a 1-to-1 strength ratio. You want to have equal amounts of strength in elbow flexion, which is biceps, using your bicep like a bicep curl, and elbow extension, which is like a tricep extension. What I've noticed in my 20 plus years of practice is a lot of people do not have a lot of strength in elbow extension. So we might spend some more time training triceps in order to make sure you don't have elbow dysfunction or discomfort or pain or an injury somewhere down the road. So how can you apply this to your own life? So let's say we had a set of 10-pound dumbbells. So if you could stand and do a 10-pound bicep curl for elbow flexion, then hopefully you would be able to do, let's say you did a skull crusher with 10 pounds, you should be able to do 10 pounds for a tricep extension motion. So if you can't do those movements in equal parts, if you don't have a 1-to-1 ratio, it would make sense if you added the weaker part into your routine more than one day a week. And then don't keep out strength training. So oftentimes what I'll see is somebody will do like 25, 30, 35 pounds of bicep curls, but then when it comes to something like a skull crusher, they're only doing like 15 or 17 or 20 pounds, and that can create a lot of problems at the elbow joint. So this is, again, something to keep in mind. If you are working with a trainer or a coach or like a golf pro, they can do like a simple assessment to test your strength and to see if you have a weakness, and then hopefully create a program in order to help you progress so that you have appropriate 1-to-1 strength in the elbow joint. Again, my name is Elaine Bintz, health coach, personal trainer. I look forward to seeing you tomorrow. Have a great day. Bye.